Okay, 8:07, let's get you back to the news now. All eyes on Ontario this morning. Premier Ford's latest restrictions facing backlash over the weekend, while the feds extending their support to our province. But will it be enough to get us out of this third wave? For more, I'm joined by Palliative Care Physician Dr. Naheed Dosani. Good morning to you, doctor.
Good morning. Thanks for having me on the show.
Thank you so much for joining. Let's begin here. International attention. You yourself were quoted in Al Jazeera over the weekend talking about our situation here in the province. Let's start with AstraZeneca, because this was the major news overnight, seeing that age lowered down to 40. In your experience, how much of an impact is this going to have in this fight in the third wave?
Well, ultimately, given the context with what we're dealing with here in Ontario, the dire circumstances of COVID-19, lowering the age for AstraZeneca access will ultimately save lives. The benefits far outweigh the risks. And when you really look at it, the pause was helpful because we got to investigate things and better understand it. But ultimately, the change in age will be good for people and will save lives. It's really important to recognize that folks get the first vaccine they get access to. That's the one that will save your life.
Now, Dr. Dosani, will it get to the right arms, though? Obviously, there are various neighborhoods, hot spots that need it more than others. So when it comes to vaccine distribution, how do you see this playing out?
So this is just it. So now we've lowered the age, but will we have equity or will we have equality? In a pandemic where we know that a significant proportion of infections are happening in low-income racialized areas, we know our hotspot communities, we need to reallocate AZ supplies to pharmacies, to people who need it most. And so that's what equity and compassion looks like in a COVID-19 rollout. And it would be very unfortunate if we see this policy change and those supplies don't get shifted to these hotspot neighborhoods.
One other discussion here is paid sick days will be debated yet again. And how important is it for workers to have access to paid sick days? We've heard from the Premier say it's there at a federal level, but why? What's the difference between what's happening with the province and what the feds are offering?
You know, it's important to recognize that for many essential workers, staying home is a privilege that they simply don't have. Nobody should have to choose between their health and paying their bills. The prospect of taking a few hours or a half day off for a COVID test is just not possible for people who work in production plants and factories. Paid sick days make sense because they keep people healthy and save lives, but also makes cost-effective sense because the alternative is letting people end up in hospital and in the ICU, which is much more expensive. We've been told by the Ontario government that we're playing political games when us health workers advocate for paid sick days, and that could be the furthest thing from the truth. We're advocating for paid sick days because it helps people, because it saves lives. The federal program just doesn't meet the needs of people who are getting sick in a pandemic. In fact, our Ontario government cut the provincial program in 2018. There was a provincial paid sick days program for a reason. Now we need it again, and we need it more than ever because we're in a raging pandemic.
When you talk about the numbers, Dr. Dosani, so just released from the Ontario Hospital Association, 749 patients with COVID-related critical illness, 60 new admissions yesterday. This is astounding. And with this federal help that is coming our way, will it be enough when we're looking at these numbers spiking? From your personal experience and all the healthcare workers that you're dealing with, where is everyone's head at right now? How are they doing?
We are in a very severe situation here in Ontario. What Ontarians need to realize is there will come a point very soon where health resources will have to be triaged, meaning there could be one ventilator, two patients, and a team of health workers will have to decide who gets access to the ventilator or not. The worst part of this is this was all so preventable. Experts, scientists, and health workers were telling our governments what the answers were on public health restrictions and other policies like paid sick days, and they didn't seem to listen. Health workers are going all out. We're experiencing burnout, compassion fatigue, moral injury. And now we're wondering, who is the Ontario government listening to? Because it's not scientists, it's not experts, it's not frontline health experts. And honestly, if the government isn't interested in saving lives at this point, what are they doing? Who are they listening to? I think we all deserve to know. We deserve to know the answers.
Dr. Naheed Dosani, thank you for your time today and all of the work that you continue to do. Appreciate it.
Thanks so much. Have a great day.
You too. All right, 8:12 is your time right now. We're going to bring you more news coming up in just a bit, but we're going to shift on gears. We're going to join the gang over there with some better stuff, some better news.